The following portion of Bloom is sponsored by Central Florida Behavioral Health Network and the Department of Children and Families.
Welcome back to Bloom. For many struggling with substance misuse in our communities, the journey to emotional wellness can start with understanding where you can find help and support. Here with more is the President and CEO of Central Florida Behavioral Health Network, Davidson, and the President and CEO of Suncoast Center, Pierre. Thank you both for being here.
Thanks for having us.
So, Central Florida Behavioral Health Network is a managing entity. What exactly is that?
So a managing entity is kind of the safety net system of care for the behavioral health system here in the Suncoast area. So we fund from Pasco County down to Collier County, over into Hendry and Glades, and up into Polk, Highlands, and Hardy. So again, think of us as like the firehouse, right? We're there for every need you have, and we fund a lot of providers. We fund 65 providers and a variety of services like crisis care, detox, outpatient, and one of the providers that we fund is here with me today, Pierre, and the CEO of Suncoast.
So how do you work together in collaboration?
Sure. So funding comes down from DCF, and then we take that funding and we put it where we see it needed most. And again, Pierre over in Pinellas County and Suncoast Center, they've been around for a long, long time and do a great service over there. Yeah,
Jean, talk to me more about what you guys do at Suncoast Center and how you help in the community.
Well, as Alan mentioned, we've actually been providing services in the Suncoast region for over 80 years now. We are a full comprehensive behavioral health organization, so we provide the full service delivery of behavioral health and substance abuse services.
So if somebody is struggling or someone you love is struggling, what should they do? What are the next steps?
We would want you to encourage them to seek treatment. We would want to ensure that they're ready to engage in treatment. They can actually call our intake department. Our intake department will complete a screening and assessment, and then we can have a face-to-face assessment completed within 72 hours.
So once somebody comes in, it seems like you have a team of people to help on many different levels, including where it comes to their mental health.
Correct. We have a full multidisciplinary team, which includes case management, therapists, we have medical providers, and most importantly, we have our peer specialists who actually have a history of recovery and actually can work with those particular clients hand by hand and ensure that they're working through the system in a seamless manner.
And Alan, because you're reaching so many people across Central Florida, it really does help to have this synergy.
Oh, absolutely. You know, Pierre, in collaboration with a lot of other providers over in the Pinellas County, makes it where someone doesn't fall through the cracks. And so we appreciate those 80 years of service that Pierre mentioned to getting the clients, you know, again, at the right time, at the right place, so they can get the delivery and the services that they need.
Yeah, because when someone is struggling, the last thing you want them to do is be caught in some maze. Seems like you guys have it all figured out.
Absolutely. We want to ensure that we have a welcoming environment and that we can ensure that the patient is ready, willing, and able to, you know, receive the help that's needed.
Well, we're certainly glad that you're here in the Tampa Bay area and beyond. And for more information, you can visit hopeforsuncoast.org and suncoastcenter.org. We'll be right back.
The preceding portion of Bloom was sponsored by Central Florida Behavioral Health Network and the Department of Children and Families.